Isabella, a girl who works at her mother's laundromat, hoping to earn a college degree one day to escape poverty. What Isabella doesn't know yet is by the time she's enrolled in college, she's already 8 weeks pregnant. From Context magazine, Isabella had to cut her academic journey short due to the demands of motherhood. This is why I believe abortions should be more accessible for college students. Now here is the main problem that we're facing. There are countless young adult college students who are either dropping out of the university or struggling to graduate due to one common reason: unplanned pregnancies. According to the U.S. Education Department, women who have a child while in college are less likely to graduate than those who do not. This is not just a number, a statistic, a label, a value. It is a real issue that affects real people. To put things into perspective, I want to give you a case study. Zoe Murray, who sought an abortion as a sophomore at UCSB. Seeking care meant her studies suffered. She told New York Times that because she was taking too much time out of her schedule to get abortion care off campus, she was forced to drop all of her classes. Many students are struggling to receive these services and are left to either keep their unintended pregnancies or experience major barriers to receiving an abortion. Which leads me to my next point. There are a handful of issues that contribute to this, but one of the main issues is college students, just like us, lack accessibility to abortion services on campus. From the National Library of Medicine, college-aged young adults in the U.S. are the most susceptible to unplanned pregnancies, but have the lowest accessibility to reproductive health care. Students need to be supported, to be heard, to be cared for. So why is there a lack of accessibility? Well, there are two main reasons: cost and travel barriers. For one, it is expensive. The average cost for an abortion in Washington state is $711, which is paid with insurance or out of pocket. But another issue arises with that. Even with insurance, students may want to keep that information private, so they're unable to pay with insurance. Some people might not even have medical insurance entirely, or some do, and insurances don't cover that procedure. So now the option is to pay out of pocket, $711 out of pocket. This is often not financially feasible for most college students. To reiterate, stated in a college abortion policy brief done for the state of California, college students have limited financial resources for many reasons: paying the cost of tuition and housing, less work hours due to school and homework obligations. All of these combined, these financial constraints limit students just like us ability to cover the cost of an abortion. UW, you must reflect and protect your students. However, the cost of abortions is not the only barrier for college students. There are also major distance and travel barriers. Most students on campus do not have cars and are left to commute. But it's not that simple. Commuting can be particularly challenging for college campuses that are not very walkable, just like UW, as big as our campus. Or it's challenging in general for out-of-state students who may not be familiar with the area. To put real numbers to this issue, stated in a Washington state legislative document, students seeking pregnancy termination face substantial travel, financial, and logistical barriers. They must travel an average of 16 miles, 73 minutes via public transit to the nearest abortion providing facility. And the average wait time for an abortion appointment is 10 days, and the average cost is $711. 10 days of waiting, 16 miles, 73 minutes, and $711. This it takes to seek medical help. Washington universities, you need us, but your students need you, and that must change. This is college campuses have an opportunity to make abortions more accessible, not only in price, but in distance as well. So now, after talking about the complexity of this issue at hand, we learn that reproductive rights and academic retention go hand in hand. Accessible abortion pushes for college completion, and without it, this crisis may only deepen. But don't lose hope, because there are solutions, and today I'm here to propose them to you. We need something that preserves access to this necessary medical service. This is why we need HB 1677 to be passed. HB 1677 would require student health centers like Hall Health here at public universities to provide access to medical abortions or provide extensive support for students needing medical abortions. Reproductive health and abortion care are essential services for academic retention, and college universities can play a key role in reducing the cost and travel barriers for students. This is why we need to push for Washington House Bill 1677. So call 800-562-6000 and leave a message for your representatives to support the passing of this bill. Flood their inboxes and make it known that we care about reproductive equity. It takes one person, one voice, one action to make a difference. But together, we can make change. Access to medical abortions on campus is not new either. In fact, Washington, you're late. California, University of Illinois have all already implemented medical abortion services to their college campuses. And this is absolutely feasible for Washington too. Be a part of this change, be a part of this movement, be a part of gender equity. So two other organizations locally that also align themselves with reproductive access in Washington are Huskies for Reproductive Freedom, which is a local RSO, and Pro-Choice Washington. Become a member of Huskies for Reproductive Freedom. Show up to campus events. There's power in numbers. If you can't become a part of this club, be a part of Pro-Choice Washington. They're a local organization that pushes for the rights of women and reproductive health. Whether it's legislation, in-person events, donate your time or money to Pro-Choice Washington. Both of these organizations have put their efforts to support House Bill 1677 through educating others, lobbying, or reminding people to message their representatives. So align yourself with these two existing organizations and help preserve the need for this essential medical service. Change starts with you. So lend a loving hand, lift lives, and lead your local communities. But before I leave you today, I want to leave you with this. Students should be trusted to know what's best for their reproductive well-being. Students shouldn't have to beg for support for a university that we pay for. As quoted, "My university wasn't there for me when I needed it. All I faced was silence and stigma," from Zoe Murray from UCSB. If Washington Health Center's roles are to minimize negative health concerns, then stand by our students. Stand by our students, make abortions access, bring them to Washington campuses, and push for House Bill 1677. So students, teachers, members of the community, we cannot settle, we cannot give up, we cannot fail our women.